प्रवृत्तये विनायकं गुरुं भानुं ब्रह्म विष्णु महेश्वरा सरस्वती प्रणम्याहं सर्वकार्यार्थ सिद्धये अभीप्सितार्थ सिद्ध्यर्थ पूजितो यस्सुरासुरैः सर्वविघ्नहरस्तस्मै गणाधिपतये नमः।
Thank you, Nitin. I would now request Dr. Ashok Bhai Mehta, Chairman, Seva Mandal Education Society, to give a welcome address.
Dr. Rajpurohit, our guest speaker this morning, Dr. Dilip Trivedi, the President, members of the Managing Committee, office bearers, members of the faculty of this wonderful institution, and Pathak family from all over the world. As soon as Dakshaben passed away, family applied their mind, especially Bharat Bhai, what is thing that we can do in her memory. She was a very kind-hearted, extremely helpful and very supportive to the entire family of Pathak. So we thought, what should we institute so that memory can last much longer than one can expect. They already have one trust in the memory of their mother, and through that we are running a reasonably good hospital in the remote village of Chorwad, their hometown. And we thought that the best thing is education. Education especially in the field of cancer. And I don't think there can be a better person today, and I'm sure you are going to listen to him and ask various questions. But importantly, Dr. Rajpurohit has been kind enough to agree to speak to us. He was extra kind in coming in for a small rehearsal that we had other day, and we are extremely happy that just to make a mention that Mrs. Rajpurohit had her basic education in our institution. So we are proud of her, and please give her our best regards to her. So friends, Bharat Bhai Pathak initially, and then the management of Seva Mandal Education Society supported very well, and today we have reached to a level where we are able to educate, especially the students and the teachers of our institution, but as well as now advantage is that it is now on the web and is going to be available on Facebook and also on the Twitter as well. So it is going to reach to a larger audience. For information of Dr. Rajpurohit, we had a number of questions coming in from outside India. And we are extremely looking forward to listen to your very knowledgeable address and learn from there. And of course, then the question and answers will come in at the later part of the time after you complete. So once again, on behalf of Pathak family, I would like to extend a warm welcome to all of you, and I hope the time that you spend with us will certainly be very fruitful and enjoyable and informative as well. And thanks to again to Rajpurohit, and thanks to Seva Mandal Education team who has ably supported us to organize this webinar this morning.
Thank you, sir, for the welcome address. Before I start with my presentation on the Memorial Lecture Series, I would like to give a brief introduction on Seva Mandal Education Society. Seva Mandal Education Society began on a humble note in 1957 with just 7 girl students who were tutored to appear for the exams conducted by the SNDT Women's University. Seva Mandal Education Society has remained true to its noble vision of empowerment of women through quality education to make them competent, self-reliant, and responsible professionals and citizens. SME's unswerving focus of imparting quality education resulted in the establishment of 8 colleges under its umbrella, housed on the same campus, offering a variety of polytechnic, junior college, graduate, and postgraduate programs. Over the last 6 decades, the institutions under its management have emerged as premier institutions for higher education of women in Mumbai city. I once again welcome you all for, for Srimati Dakshaben Pathak Memorial Lecture Series on Women and Health. Srimati Dakshaben Pathak Memorial Lecture Series on Women and Health was instituted by Dr. Bharatbhai Pathak, Honorary Secretary SMES, in the memory of his late wife who succumbed to cancer on 3rd September 2007. We are thankful to Dr. Shilpa Charankar, Executive Secretary, Seva Mandal Education Society, who started this initiative to promote awareness among the students and staff of SMES colleges on important issues related to women's health. The sessions which were conducted so far by eminent doctors. The first session was conducted in the year 2008 by Dr. S. Shastri on preventive cancer and Dr. Asha Kaparia on tobacco and cancer. In the year 2009, Dr. S. B. Javeri spoke on osteoporosis and Dr. Alok Sharma spoke on stem cells. In the year 2010, Dr. Anita Bojas spoke on breast cancer, followed by Dr. Harikesh Bojas' lecture on stoma care in India. In the year 2011, Dr. S. Bhattacharya spoke on cardiac problems and Dr. Rama Vaidya gave a lecture on menopause in the year 2012. In the year 2013, Dr. Vipul Roy Rathore spoke on the role of endoscopy, and in the year 2014, Dr. Baman N. Dhabar gave a lecture on women-related cancers. Dr. Dheeraj Kapoor spoke on health and diabetes in the year 2015, and in 2016, Dr. Alan Almeida spoke on health and renal diseases. In the year 2017, we had Dr. Nivedita Maulik, who spoke on thyroid and its disorders. And in 2018, Dr. Mayur Trivedi spoke on kidney diseases, key challenges, and considerations. Last year, that is 2019, we had Dr. Amita Athavle, who spoke on tuberculosis and resistance to multiple drugs. And today, 5th September 2020, we are privileged to have with us Dr. Birendra Rajpur, consultant surgical oncologist from Jodhpur, and sir is going to talk on the topic, is cancer a death sentence? I would now request our principal, Professor Mala Pandurang, Dr. BMN College of Home Science, to please introduce Dr. Virendra Rajpurohit.
Thank you, Dr. Gandhi. Good morning and warmest greetings on occasion of Teachers' Day. It is my privilege to introduce Dr. Virendra Rajpurohit, who is a renowned cancer surgeon, worked at the esteemed Asian Institute of Oncology, along with stalwarts of surgical and oncology. In over 15 years of practice, he has carved a niche in surgical oncology and its subspecialties. He is the recipient of the prestigious Varun Mahajan Fellowship at Memorial Sloan Kettering Cancer Center, New York in 2003, where he worked on treatment of esophageal and lung cancers. He has also been awarded a fellowship by the Department of Esophageal Diseases at Kurume University Hospital, Japan, where he worked with some of the leading esophageal surgeons in the world, including Professor H. Fujita. His extensive exposure to the latest technology and medical practices in world-renowned centers has fine-tuned his clinical judgment. His peers and colleagues have vouched for his impeccable precision, even during most difficult surgeries. After working for over 8 years in Mumbai's leading hospitals, he decided to serve his hometown, where he established Jodhpur Cancer Clinic in 2012, one of its kind cancer consultation centers in the city. He has organized various public event and awareness programs in terms of didactic lectures, talks, presentations, workshops, walks, rallies, camps, and street plays. His initiative to spread breast cancer awareness has received an overwhelming response, especially events like talk show on cancer, pink wall, and lighting historical heritage monuments in pink for the first time. In the media's words, Jodhpur had done what Washington, D.C. did in its commitment for spreading awareness on breast cancer. Dr. Birendra Rajpur believes that cancer treatment is not a single person's domain, and that results are achieved only with a team effort combining the best of the existing branches of oncology. His seniors and mentors call him one of the most hardworking, innovative, and passionate surgeons that we have, and list him in the top 10 surgeons of India. And yet, through our interactions with Dr. Rajpurohit, we have come to appreciate the down-to-earth humility of this soft-spoken, remarkably gifted doctor. I take the liberty of also stating that Dr. Rajpurohit is a member of Seva Mandal Education Society, since his wife Meghna is our alumni. And as we always say, once a part of the Seva Mandal societies, you become a family member for life. We extend a warm welcome to Meghna and other family members also. And we look forward to the doctor's presentation. Thank you.
Thank you, ma'am, for the introduction. One message for the audience. You can put your questions on the chat box. We will be taking the questions after Sir finishes with his lecture. Ladies and gentlemen, we have Dr. Birendra Rajpur. Sir, over to you.
Thank you, Dr. Roma. Thank you, Dr. Mala, for this kind introduction. It's an honor for me to be invited by Seva Mandal Society today to deliver Srimati Dakshaben Pathak Memorial Lecture. I must extend my gratitude to Bharat Bhai, Professor Mala Pandurang, Dr. Kirti for giving me this opportunity and coordinating with me impeccably. Good morning, Dr. Dilip, the President, Dr. Ashok Mehta, Honored Chairman, Dr. Bharat Bhai Pathak, the Secretary of the Seva Mandal Education Society, Professor Mala Pandurang, Principal, Dr. Kirti Pathak, office bearers, faculty members, staff members, dear students, ladies and gentlemen. Well, today is Teachers' Day, and I'm feeling privileged to be starting the day by sharing this platform with the faculty members and students of this eminent institute. I bow down to all the teachers present in this forum and to my mentors who have worked relentlessly and very hard to make me a better surgeon and, more importantly, a better person. This lecture series, as explained by Dr. Roma, is dedicated to issues related to women and healthcare. I will be talking about cancer in general with special mention of cancers in women. As mentioned in the introduction, I've been dealing with this so-called dreaded disease for almost 2 decades now. I have seen a lot of changes in the mindsets of the people regarding facts related to this disease. But unfortunately, one thing still remains common, and that is believing it to be a death sentence. Mostly, the first response of any person, a patient who walks into our clinic and when we disclose the diagnosis of cancer, is identified with fear, trauma, guilt, and death. There was a survey conducted in the United States of America assessing the response to the diagnosis of cancer. Majority, around almost 62% of the respondents perceived cancer as a death sentence. More than 1/3 of the respondents reported that they avoid seeing their physicians. Is it really that bad? I can assure you with my experience and on behalf of my fellow oncologists that it is not. Not everything about cancer as portrayed by the media and the society is as gloomy as it is displayed. Thanks to the relentless work by the clinicians all over the world, researchers, scientists, companies funding billions of dollars, people expending their time and money finding for a cure of this disease. And hopefully very soon we will have a cure for this disease. So why is it important to be aware about everything related to this disease? Let's have a look at some of the figures which will let us know what is the burden of this disease all over the world and in our country. The figures on your screen are from the Globocon 2018. There were almost 18.1 million new cancer patients diagnosed in year 2018 all over the world. Around 9.6 million cancer deaths were recorded in the same year. If you see the graphs, the incidence is high in developed countries, let's say Americas and the Europe. But if you see carefully the mortality, the death rate is higher in developing countries, the low socioeconomic strata countries. The reason may be because of there is lack of awareness, there is lack of access to the quality healthcare facilities. Now let's take a look at the disease burden in our country. These are the figures from the same Globocon 2018, the recent figures. Nothing much has changed though. We have seen almost 1.15 million new patients added to our the case list of cancers in 2018, and almost 7.85 lakh patients died of this disease. Now, if we see the prediction by WHO or the funding bodies is that by 2025, every family will have one cancer patient. And that's very alarming figure. It took almost 8 decades for these numbers to double. In 6 decades, 1960s, the incidence of cancer in India was around 600,000, 6 lakh patients, and which is now almost double, 1.2 million patients a year. It took almost 8 decades, but surprisingly and astonishingly, it will not take that long for this number to double. It is predicted by 2040, we will have double the number of cases and deaths because of cancer. And these figures are alarming, and that gives us a reason that we should know about it. We should not hide away our feelings. We should not hide the symptoms and ignore this disease and not seek a medical advice. And if we see the figures in our country, in males, the most common cancers are oral cavity cancers and lung cancers. And the most common risk factor for these is tobacco consumption. In females, as we talk specifically, the commonest cancer is breast cancer, which constitutes for almost more than 1/4 of the numbers. If we add cervical as well as ovarian cancer to the list, they form almost 50% of the cancers. And believe me, maximum number of these patients, these cancers can be prevented, and we'll see how. So before we move on, it's very important to understand the basics of cancer. What is cancer? What are the risk factors of cancers? Can the cancer be prevented? How is it diagnosed? How does it spread? And what are the treatment options that we have? To talk in a very general terms, cancer is uncontrolled growth or uninterrupted growth of the cells. Our body has a very balanced mechanism where the cell proliferation, replication, and death is very well balanced. If for some reason, that's what we will discuss, the risk factors which cause this break in the balance, for somehow if this balance is broken, the cell proliferation increases, or the cells do not die. And then increasing fastly proliferating cells take the form of a tumor, a lump, and that is known as cancer. Now, these tumors can be benign tumors or these tumors can be malignant tumors. Benign tumors are the ones which are localized ones. They do not spread to the other organs in the body. And the malignant tumors are known for their potency to spread to other organs. They may spread to the other organs by means of direct invasion, by lymphatic spreads, or spread through the bloodstream. We will mainly focus on the malignant lesions since these are the tumors which are commonly known as cancers. Now, if we know the risk factors, probably we will have a chance to prevent the cancer. Now, if we go to the list of the risk factors, what causes cancer, it's very important to understand this. Now, if you see this diagram, you'll see majority of these cancers are caused by tobacco consumptions and changes in our dietary habits, very poor diet habits that we see in our today's society. Now, tobacco consumption, it can be in a form of smoking or it can be in the form of smokeless tobacco. You'll be surprised to see that there are almost 1.2 billion smokers in the world today, and another hundreds of millions of consumers who consume smokeless tobacco, and mainly in Southeast Asia, where you must be aware that mostly people will be chewing tobacco, kaini, mira, jarda, gutka, whatever name they call it, but they do consume tobacco in one form or the other. Globally, around 21% of the deaths were attributed to tobacco. In USA, 33% of the deaths were attributed to tobacco consumption in last year. That's the maximum number, the maximum most important risk factor that you see. Second most important risk factor is diet and dietary habits. Now that would include maybe lack of consumption of fruits and vegetables or excess consumptions of processed food, processed and red meat, maybe consumption of GMO, genetically modified organisms in the form of seeds or food. We are not sure of what food is being served on our table, where is it coming from, what fertilizers, how much is the amount of pesticide used to grow the crops. We are not sure of all these things. And probably this is the reason why we are seeing an increasing number of cancer patients. The incidence is increasing day by day, every day. So these two are the major risk factors. Then there are some viral infections which can cause cancers. Commonly, it is hepatitis viruses which cause liver cancers. Then there is human papillomavirus which causes cervical cancer, anal cancer, or in some cases, oral cancers, oropharyngeal cancers. Then there are occupational hazards, workers who work in dye industries like aniline dyes, asbestos. They are prone to developing certain types of cancers. If we talk about risk factors can be either genetic risk factors or the environmental risk factors. Fortunately, genetic risk factors do not comprise of vast numbers. They comprise of only 5 to 10% of the number of cases. Majority of the cases are seen because of environmental risk factors, and these are the modifiable risk factors. If you see at this graph, the number of deaths by risk factors, 2017's figures, again, you will see mostly the listing comprises of lifestyle changes, high blood pressure linked to poor dietary habits, smoking, lack of physical activity, high salt intake, and it causes 10.4 million deaths. Smoking caused 7.1 million deaths. These figures are staggering, alarming numbers. You can see pollution, obesity, alcohol use, diet low in fruits, diet low in vegetables, low physical activity, unsafe water sources. Most of these things, as your common sense will tell you, can be avoided, can be prevented. So if we apply our common sense, if we say, like if we did not smoke, none of the person in the world smokes, we can prevent 7.1 million deaths. And that's a very significant number. These are the figures, the preventable causes of cancers. As I mentioned, 33% of the cancers can be prevented if we do not consume tobacco. If we control our weight, 20%, another 20% of the cancers can be prevented. If we control viral diseases, we will come to it. By means of vaccination, we can control another 16% of the cancers. So by subtle changes in our lifestyle, by avoiding certain substances, we can control so many numbers of cancers. Now let's talk about the most common cancer in the world, the breast cancer. Now the risk factors for the breast cancers can be categorized as uncontrollable risk factors or controllable risk factors. The uncontrollable risk factors are gender. We cannot control our gender. And female gender is the most common risk factors. 99% of the breast cancers happen in females. Only 1% of the breast cancers are seen in male population. As you age, your risk of developing breast cancer increases. When you're in your 30s, the chance of you developing breast cancer is 1 in 250s. But when you cross the age of 60 to 80s, your chance of developing breast cancer falls in the category of 1 in 30s. So as you age, and since we are seeing the increase in life expectancy in our country, we are seeing more and more number of cancer patients, not just breast cancer. Age is a risk factor for majority of the cancers. Then genetic factors, as we discussed, around 5 to 10% of the patients inherit it through their family, through their maternal side. So if you have a family member who is diagnosed with a cancer, breast cancer or ovarian cancer, first degree relative, I would say your mother, your great-grandmother, grandmother, your aunts or sister, then you must screen yourself for your risk of developing this cancer. There is a gene test available known as BRCA1 and BRCA2, which family members of breast cancer patient survivors should undergo. Then early menarche, late menopause exposes to female hormones, and more you are exposed to female hormones, higher is your risk of developing breast cancer. Exposure to radiation for treatment of another cancer increases your risk of developing cancer. Now, there are some risk factors which can be managed, which can be controlled. Obesity is one of these, particularly after menopause, increases your risk of developing breast cancer. Lack of exercise. If we give ourselves 30 minutes or 1 hour of every day, we indulge in some form of physical activity, we will reduce our chances of developing not only cancer, but so many lifestyle-related diseases. Eating lots of processed foods, fatty foods, using hormonal birth control methods, hormone replacement therapies, not breastfeeding. In our society, breastfeeding was always promoted, but as we are, leading towards Western practices, not many people, ladies in the urban population prefer breastfeeding, and that increases your risk of developing a breast cancer. Giving birth at an older age, especially children born after the age of 35, the risk of your developing a cancer is very high. Having less number of children, your risk is higher. So simply, if we see, we can prevent certain number of breast cancer patients if we do exercise, if we maintain a healthy weight, and if we limit alcohol intake. A brief note about cervical cancer also. And finding cancer early, why is it important? If majority of patients in our country come to us, seek a medical advice in their late stages. Most of the patients that we consult come in the stages of stage 3 or stage 4. While in Western world, where the incidence is high, but the mortality is low, because the patients come in very early stages of the disease, stage 1 and 2. Now, the reason, as we are discussing, is lack of awareness. We do not know the symptoms. Even if we know the symptoms, we tend to ignore the symptoms because we are a very resilient population. We do not give a damn about minor symptoms. And the worst thing about cancer is it is painless to start with. If we talk about the symptoms, the most common symptom is a form of a lump, a tumor anywhere in the body, or it takes a form of an ulcer. If we talk about oral cancers, patients will notice a very small ulcer in the oral cavity. Since it is painless, they will tend to ignore it and they will say it is not causing any problem to me, and they will not seek a medical advice. And by the time they come to us, they already have an extensive disease spread to their bones. They will come with the nodes in their necks. If we talk about most common symptom in the breast cancers, it is the form of a lump. Again, it is a painless lump. Females do notice a lump in their breast, but then again they ignore. They say it is not causing any problem to me. It is painless. So why should I seek a problem? They commonly associate it with a benign thing. They call it an abscess, they call it a maid, whatever local term they use, but they will avoid seeking a medical advice. Another common symptom is bleeding. Now, bleeding other than your normal menstrual cycle from any part of the body is not normal. Bleeding from your nose, bleeding in your sputum, in your cough, bleeding in your urine, bleeding in your rectum, stools, nothing is normal. Yeah? You may think that the bleeding is because of gum infection, though it may be because of first warning sign of cancer. So rather than keeping yourself in dark and not seeking any medical advice, if you notice a bleeding, even a single episode, I will request that you must seek a medical attention. Let your doctor, let your clinician let you know that this is not cancer and it is because of some infectious cause or some benign condition. Let them take the call. Let them investigate you further. Make sure that this is not cancer. Lung cancer, again, the most common symptom is cough or chest pain. Now, majority of patients, these people are already smoking, so they will have some form of cough known as smoker's cough. So they will tend to ignore these. So these are the warning symptoms, warning signs, and we should not be ignoring these signs. This is what we mean to say. And finding cancer early will help you seek a medical advice early and increase your chances of getting cured of this disease. If you're aware of the signs and symptoms, you will seek medical advice early. Now, another form of finding cancer early is screening. Screening is a form of secondary prevention. The goal of screening is to identify the cancer either before it happens or to diagnose it in early stages to reduce your chances of mortality or reduce the severity of the disease. Now, screening is not available for all forms of cancer, but it is available for breast cancer, the most common cancer, in the form of mammographies, for cervical cancer in the form of a simple, very simple test, pap smear, for colon cancer, rectal cancers in the form of occult fecal blood test, or in the form of scopies, segmentoscopy or colonoscopy. For prostate cancer, a tumor marker, PSA is available. For certain people with who are in high risk of developing lung cancer, we can screen these people with low dose CT scans. So let's talk about breast cancer here. Screening for breast cancer, there are certain guidelines, and the guidelines now says that every woman in her 40s should get an annual yearly mammography done. If you are in your early 40s, you should get a mammography done if you fall in a high risk category. High risk category means if you already have a family member who was diagnosed with breast cancer. But beyond age of 45, if available in your vicinity, you should get yourself checked annually, clinical examination, and a mammogram done. Advantage of mammography is mammogram can detect a cancer which is in the size of 1 to 1.5 centimeter. But if a patient notices a lump or a clinician feels the lump, the median size that we diagnose by clinical or self breast examination is around 2 to 2.5 centimeter. Now that's where screening or early detection helps. If you see the survival of breast cancer in stage 1, it is more than 95%. That means 95% out of 95 out of 100 patients will survive more than 5 years if they were treated in stage 1. On the contrary, if you are treated in stage 4, if you're diagnosed in stage 4 in breast cancer, your survival for 5 years is around 20%. That means only 20 out of 100 patients will survive beyond 5 years. So that's where the importance of diagnosing it at early stage and getting it treated in early stage comes in goal. So if we screen ourselves, get ourselves screened, if we do cell breast examination, we can avoid certain number of breast cancers for developing. Now that's a cycle of, I stress upon awareness a lot. If we are aware about the signs and symptoms of the disease, if we are aware about the treatment options, if we are aware about the facilities available in our vicinity, we will seek help. If we do not know that why there is bleeding from my bleeding in my stools, why there is bleeding from my cough, I will tend to ignore it. There are patients who come and they will say, oh, there was a bleeding similar episode 6 months ago. I thought I did not drink water, so my urine was dark. I did not consider it to be bleeding. I thought I consumed a lot of beetroots. That's why my urine was dark. So they will apply their own logic and they will ignore the symptoms. So if we are aware about the symptoms, we will seek the medical help very early. I always give this example of my grandmother. She was in her 90s, and since we used to discuss a lot about cancer, the patients, she would inquire about my clinical practice. So one fine day she called me and she herself noticed a small lump in her breast. It was size of 1.5 centimeter. Fortunately, it turned out to be very low-grade cancer. All she required was a single tablet a day, and she was cured of the disease. So if we are aware about the symptoms, we will seek help very early, and we will accept the disease. So it's a cycle. Now the question comes, how the diagnosis of cancer is made. The only sure way to diagnose cancer is getting a sample of it, either in the form of a cytology, fine needle aspiration, or a small piece of tissue known as a biopsy, and reading it under a microscope. Now, there are a lot of myths associated with diagnosis of cancer. Not many patients would agree to get a biopsy done. They think that touching the cancer, taking a biopsy, taking a piece out of it will help it spread further. So they resist the biopsy, and that delays the diagnosis. We see patients who fortunately seek medical advice in very early stages, very small lump. Though it is painless, and when we suggest biopsy, they ignore it. They say, I'm not having any complaints because of this, so maybe I will wait for some days and then I'll get it biopsied later, because this myth in their minds is very strong that if you touch a cancer, it spreads faster. And believe me, it is only a myth. There is no proven study to support this myth that touching a cancer spreads. If we only do a biopsy and not treat it by sheer behavior, cancer will spread. If we do incomplete treatment, if the patient requires chemotherapy in addition to surgery, and they do not undergo chemotherapy and they take only one form of treatment in the form of surgery or chemotherapy, the chances are higher that they will have a recurrence of the disease. So if you treat the disease incompletely, it will spread. Not just mere touching the cancer will let it spread. So this is only a myth. You should accept, or you should agree when your clinician says that we should biopsy it. It will not let it spread. Now a brief note about the treatment options that we have amongst us. The initial treatment that was available with was surgery, only in the form of surgery, and the surgeries in early 90s used to be very radical surgeries. They used to remove a whole part of the body, whole organ and nearby organs to get rid of the cancers. But very soon they realized that just removing only the organ did not help prevent its spread or its recurrences. That's where research was enhanced, newer drugs came into vogue, chemotherapy drugs were added, radiation therapy was added. So the three main streams for treatment of cancer are surgery, medical management in the form of chemotherapy, and radiation therapy. Thanks to the recent research, now we have hormone therapy with us, we have bone marrow transplants with us, we have targeted therapies, and the recent most addition to this armamentarium is immunotherapy. So there are a lot of options available, but at the same time, there are a lot of myths available with the treatments related to the cancer. Patients do not undergo surgery, as we have already discussed. Believe me now, as I said initially, there were very radical surgeries happening. Now we have come to organ preservations. We are not doing radical surgery. We can preserve organs, remove only the affected part, remove dead part through minimally invasive approaches, be it laparoscopy, be it thoracoscopy, and recently the robotic approach. The recent researches have reduced the complications of major surgeries, the morbid surgeries, and the outcomes are far much better. The chemotherapy, the side effects have reduced, and we have latest drugs to reduce the side effects of the chemotherapy, so you should not be afraid of the chemotherapy. Now, mostly people talk about side effects of the chemotherapy and they do not talk about the benefits of chemotherapy. Because the side effects appear immediately, within a day or two or a couple of weeks of initiating the chemotherapy, they will experience these side effects. So that's why they only stress upon the side effects, but they tend to ignore the benefits that the chemotherapy is saving their lives. These side effects are temporary side effects, and the moment we stop chemotherapy, your body heals itself, your cells start healing themselves, and the side effects disappear. Similarly, there are myths associated with the side effects related to radiation therapy. So as we discussed, if we treat the cancers in early stages, our chances of survival are higher. Now, majority of patients tend to keep quiet. They do not want to discuss with themselves. They don't want to let themselves be told that there is a cancer in their body. The relatives that come with the patient, they tell us that do not disclose the diagnosis to the patients, and they do not, because of lack of awareness and acceptance, they do not seek medical advice. So my only point to discuss here is talk more and more about cancer. Spread the word, spread awareness about cancer, spread awareness about the recent advances in the cancers, what newer modalities can do. If you treat yourself, get yourself treated in early stages, the chances are higher that you will be cured of the disease. Now with this one simple slide, you can see 4 out of 10 cancers can be prevented with very few minor changes in our lifestyle. If we do not smoke, if we keep a healthy weight, if we eat fruits and vegetables, if we drink less alcohol, if we avoid excessive sun exposures, eat less processed and red meat, eat a healthy fiber-rich diet, be active, and eat less salt, we can prevent certain numbers of cancers from happening in our body. So if we see with this brief lecture of mine, you can make out that there are a lot of treatment options available to us. There are a lot of methods by which we can prevent the cancer from happening. If at all it happens, we can treat at an early stage. We have a lot of options to cure you out of this disease. So with availability of all these things, I do not think that cancer is a death sentence. It's a mere word. And together we can, if you do not, let yourself be diagnosed at an early stage, if you do not seek medical advice, you can make it a death sentence, though it is not one. Thank you so much. I'll be happy to answer any questions.
Yes, sir, I'm coming to that. Thank you so much, Doctor, for the lovely informative talk. So the first question is that are cancer patients supposed to take extra care during this pandemic period?
Yes, that's very genuine question and very relevant question during this pandemic. Corona is spreading. Cancer patients are more susceptible, especially those who are currently undergoing chemotherapies. But we have to weigh the benefits of the treatment against against the risks of the cancer patients getting affected with the disease. If you are undergoing a cancer treatment and the disease is aggressive, the treatment cannot be delayed, then you must take the treatment with due precautions or in a very isolated environment. But if your cancer is like thyroid cancer, very early stage breast cancer, certain other cancers, and if with discussion of your clinician, we can delay your treatment to some extent. But since we are not sure of the prognosis or the extent of this corona pandemic, we are not sure when it will end. We cannot delay your treatment endlessly. So it's a very calculative risk. Seek your physician, seek a video consultation, and whatever your clinician feels right, depending upon your type or stage of the cancer, he will take the decision and guide you accordingly.
So the next question is, what causes myxoma in the heart? So I don't know if I've pronounced it right. Is it likely to recur once operated upon?
Well, you have asked about one of the rarest tumors. Very few patients are diagnosed with myxoma of the heart. Um, the exact causes are not known. Mostly there is genetical error, mutation that we call, that happens, and the cells start growing and take the form of a tumor. That is known as myxoma of the heart. And as it is true with any tumor in the body, it is true for myxoma also. If not treated rightly, if not treated at an early stage, there are theoretically chances that it may recur.
So we're waiting for some more questions to come in.
While we're waiting for more questions, I may say what generally patients that seek our consultation and come up with the doubts. Most common is, I have already discussed, the myth about biopsying the cancer. It's only a myth. We should not be afraid of getting it biopsy and getting it treated. Another common question is it a communicable disease? If I'm taking care of a cancer patient, will I get a cancer myself? So let me tell you, it is known as a non-communicable disease. Cancer doesn't spread by staying with a cancer patients or treating a cancer patient, just taking care of cancer patient. It's not a communicable disease. It will not spread to you if you take care or if you're a relative of a cancer patient.
So the next question is that my follow-up with Tata was in the month of May, but I could not go to the hospital due to COVID. I had breast cancer in 2014. Is it okay if I go in the month of November?
Well, if you had residence 2014, you have already crossed 5 years survival rate that we were discussing. And beyond 5 years, we would consider you as cured of the disease. And we only recommend annual mammographies or follow-ups and examinations. So you are safe. You can delay your follow-ups by a couple of months and nothing will happen to you. Unless you notice a change in your body, unless you notice a symptom, you can seek early advice. Otherwise, if you find everything normal with your body, you can delay your consultation.
So the next question is that, doctor, can you tell me more about thyroid cancer and its diagnosis?
Well, thyroid cancer is one cancer which is categorized one of the least aggressive cancers and one of the most aggressive cancers. Anaplastic cancer is one of the most aggressive cancers in the body, which is though rare, fortunately. The majority of the thyroid cancers are very indolent cancers, very less aggressive cancers. They are very slow growing, and these are the only cancers where age is considered as a risk factor. So if you are below age of 55, you will be considered as having only stage and stage 2 diseases, 1 and 2 disease, even if your disease is gone beyond the thyroid into lungs or bones. So it's a very safe cancer, very slow growing cancer. The diagnosis is mostly done by a simple test, sonography of the neck. Rarely we can ask for a CT scan of the neck and chest, depending upon the clinical stage. And an FNA, a fine needle aspiration cytology, is all that is required. It's a very simple outpatient basis test. It's done, and within a couple of hours, we'll get the report. The surgery is simple. Your thyroid lobes will be removed, again, depending upon the stage of the disease, the size of the nodule that you harbor in your thyroid. We may remove whole of the thyroid and the lymph nodes around, or we can only remove the affected part, only the right side or the left side of the thyroid lobe, which is harboring the disease.
So the next question is premature birth a cause of cancer as Barker's theory says so?
Premature birth as such is not a dominant risk factor. But unless, because of prematurity, there are other milestones which are delayed. If the child is given a drug, if the premature delivery is because of hormonal exposure to the mother, there may be a marginal increase in the size of the risk to the baby.
So is there any vaccination to prevent genetic cancer?
Yes, I was coming to this question. There are vaccines, as we discussed, there are certain viruses which cause cancers in our body. The common viruses being hepatitis viruses and human papillomavirus. So the most common vaccine which is recommended for general population is cervical cancer vaccine. It's very freely available in the market. Any female, especially though it is recommended for boys also, before marriage, in their early age of life, recommendation is starting from the age of 9, they should get vaccinated for cervical cancer. It's a human papillomavirus vaccine. It safeguards you against cervical cancer, anal cancers, and some form of oral cancers also. So every young boy or girl should get themselves vaccinated for cervical cancer, human papillomavirus vaccine. And there is this vaccine, hepatitis B virus vaccine. Though it is not recommended for general population, it is recommended for high-risk professionals like surgeons, healthcare professionals, those who are at risk of exposure to blood and blood products. They are vaccinated against hepatitis B virus also.
So why have cancers increased so much from last 1 or 2 decades?
As we discussed, the number of risk factors, our lifestyle is changing, our addictions are increasing more and more, though America is, the numbers, the graph of smokers has gone down since late 90s, and lung cancer incidence, that's the only cancer which is showing a decline in the numbers currently because of the hard work. 3 to 4 decades, the number of smokers has gone down in USA. So we are seeing more and more addictions in our lifestyle. We are consuming more of processed food, more of packaged food. We are not having our homemade foods or our grandparents used to cook at home. We are ignoring that, and we are falling prey to the ready-to-eat fast foods, the packaged foods, sedentary lifestyles, lot of stress to finish your targets, very erratic sleeping patterns. All these factors are increasing the chances of the risks of developing a cancer.
Can lack of sleep or insomnia and stress add to the risk factors?
Not directly, it may be related to one of your non-communicable disease. But yes, a prolonged stress, prolonged insomnia will make some changes in your body. The gene signals, as we discussed, it may promote mutations and to some extent uh, development of a cancer.
A goiter removed once, tested non-malignant, is there a chance of a growth again, and how to diagnose?
Well, yes, if only a part of the thyroid or only the goitrous portion of the thyroid was removed, there is a chance that goiter may develop in the remaining thyroid. Let's say if only one side of the thyroid gland was removed, the reason for which the goiter developed in one side, reason remains there, goiter may develop on the other side of the thyroid also.
Sir, a child born with cancer can be cured.
Yes. Fortunately, all these neonatal or the childhood malignancies are curable malignancy. Very few are very aggressive. Children respond very well to treatment, and most of these are managed by medical management only.
Sir, can you please explain cause and treatment of adenocarcinoma?
You mean adrenocortical carcinoma?
So the person has just written
Or,
adenocarcinoma.
well, adenocarcinoma is a form of cancer which, we can divide cancers into carcinomas, sarcomas, lymphomas, hematological malignancies. In the carcinoma, there are different varieties. More common means squamous carcinomas or adenocarcinoma. So specifically which adenocarcinoma the person is asking, we cannot describe very vaguely, but as we discussed, the risk factors uh, are already discussed. For one specific malignancy, the risk factors are different. The treatment again depends on which carcinoma we are talking about. The majority of patients require surgery, chemotherapy, and radiation, or either alone or in combination form.
So does carrot juice help to reduce cancer cells?
Please come again.
Does carrot juice help to reduce cancer cells?
There is no definite evidence, but yes, vitamin A consumption, if you're talking about, to some extent, it will prevent cancer development. Or if someone who is already diagnosed with cancer or is under treatment, and if the person thinks that consuming only carrot juice and not undergoing surgery, chemotherapy, or radiotherapy will cure him, then that's a very wrong notion. We do see patients who come to us, they are in their maybe early stages or late stages of disease, but then they fall prey to alternative forms of treatment which do not have a cause-effect relationship or research background to back their claims, and they seek only what you're talking about, certain herbal products, or seek some you know I wouldn't like to mention those products here, but they seek only those products and think they will be cured of the disease, but that's not true. If you're taking all those alternative medicines in addition to the established forms of the treatment, the surgery, chemotherapy, and radiation, we have no objection.
So what is your take on treating cancer using allopathic medicines versus diet or Ayurveda?
Well, I'm not an expert on Ayurveda, so I will not be the right person to comment about it. But in our experience, Ayurveda alone cannot treat solid tumors. Solid tumors will require sooner or later in some form surgery, chemotherapy, or radiation therapy, as I have been repeatedly mentioning. Ayurveda may be helpful in dealing with medical diseases like asthma, diabetes, stress, insomnia, heart pressure. But cancer, once it has taken a form of a solid tumor, a lump, a growth, only Ayurveda will not be able to achieve cure.
So since we are running out of time, I'm taking the last question of the day. Why is there a massive increase in cervical cancer among women in recent times?
As we have discussed, the cause of cervical cancer is human papillomavirus. Almost 85% of us will, in some part of our life, will harbor this virus in our body. The chances of cancer increases when we harbor different strains of the virus. Chances increase with multiple sexual partners, with improper hygiene, improper sanitation, improper taking care of yourself during your periods, increases the chances of developing cervical cancer. These numbers are increases now.
Is falling hair can be considered as one of the symptom of cause?
Falling hair per se is not a symptom of cancer, but it's a side effect, or you can say an unwanted adverse effect of some chemotherapy drugs.
I think that was the last question, sir. We don't have any more questions. Uh, uh, Audience, if you have questions later on, you can always email it to us and we can forward it to sir for the answer.
Roma, there is a request from Ashok Bhai.
Yes, sir.
He want to ask one question.
Sure, sir. Sure.
Okay. Dr. Rajpurohit, there is a sort of reservation of declaring somebody a part of the family having a cancer. And some people are very conservative or not declaring till the last time, or some people are so open. So what do you suggest when some close relations having a cancer, what one should do psychologically?
Very pertinent question. Unless you think the person whom we are dealing with is very, very weak at heart, very emotionally, psychologically labile person, we should disclose this diagnosis to the person concerned. So initially the person will be in a state of shock, but that will be only once. The science, the research, the studies conducted have proved that if the person who is in question is knowing what disease he is harboring, what treatment options he has, if we do not tell the patient that you are harboring a cancer, we cannot discuss the treatment options, and we will deprive that person from the recent advances, different treatment options. He may undergo just one treatment. Very often the relatives tell that you don't have any disease, there is small ailment, and we will give you certain injections and you'll be all right. The person takes 1 or 2 cycles of chemotherapy and then disappears. He says that I'm all right, I don't have any more symptoms now. So that reduces the chances of the person from seeking medical advice and follow-ups and being treated completely. So if the person knows that what disease he has, psychologically, there are better chances that he will be adhering to the follow-up advices given by the medical oncologist or the clinician. It should be declared to the patient. Unless you know that the person is very old, the person is very emotionally labile, the disease at question is very insignificant, very early stage disease, all the person requires is a single tablet, we may probably hide the tumor. But in today's world, with social media so rampant, the information available so much around us, I have large board displaying cancer center. There will be 10 patients sitting outside discussing cancer. However, you think that you are hiding it from the person will be knowing that he has a cancer.
Thank you. Roma, tell you.
Yes, sir. Thank you so much, sir, for solving our queries. I would now like to call upon Dr. Dilip Bhai Trivedi, President, Seva Mandal Education Society, to give his response on behalf of Seva Mandal Education Society.
Dr. Rajpurohit, my colleagues and friends, I think it was an excellent lecture which Dr. Rajpurohit gave with a general information to the crowd that he was addressing, and at the same time with lot of patience he answered all the questions, whether medical, they were non-medical, psychology and everything. On behalf of Seva Mandal Education Society, I would like to thank Dr. Raj Purohit for such a nice lecture that he gave about cancer. Because as we know, you must have seen the number of speeches from 2007, I think, 13 speeches. Cancer has been the main subject which has been given to the public. Thank you. Thank you so much.
Thank you so much, sir.
I would now like to call Dr. Leena Raje, Principal, Srimati MMP Shah College of Arts and Commerce, to give the vote of thanks.
Thank you, Roma. Good afternoon, everybody. It is my proud privilege to be here and offer the vote of thanks. Most importantly, our today's resource person, Dr. Virendra Raj Purohit. Sir, I would like to thank you from the bottom of my heart for an extremely educative, simple, very lucid presentation, but it has really enriched us. As rightly chosen, the topic was, is it a death sentence? Is cancer a death sentence? And truly, we, as a common person, we have this feeling. The moment we hear this word cancer, we really feel that no, there is no life for us. But through such talks, I think all of us can develop a positive attitude and we can change our perspective towards cancer. Thank you very much, sir, for bringing us to that state of mind. I am extremely thankful to Dr. Bharat Pathak and the entire Pathak family for giving us this wonderful opportunity of exposing us to all such good talks, which tell us about various health issues and especially in the area of cancer. This idea of Srimati Dakshaben Pathak Memorial Lecture Series on women and health is very, very useful for all of us at SMES. Bharat Bhai, thank you once again to all of you and the entire family for this wonderful activity. My thanks go to Dr. Mala and the team BMN for their excellent organization and hard work all throughout the arrangement of this program. I would like to mention especially Dr. Roma Gandhi, the seminar and workshop team main person, convener. And I would like to thank Mr. Nitin Pawar, the technical support person who have taken all this responsibility of arranging this program. I know what efforts are required to coordinate and to get presentations from everybody, to be on time and to keep coordinating. Thank you for the wonderful job that you people have done. And I would really like to thank everybody at SMES for really creating this kind of atmosphere that all of us feel a great sense of belongingness. And for any program that we have, all of us are here together, attentive and feeling a part of the program. That is the feeling that SMES always keeps giving us. Thank you once again. Thank you one and all.
Thank you so much, Leena ma'am. Dr. Rajpur, one request. We know that you're very busy, but we would really like you to join us for the Teachers' Day event, which is soon going to start. Dear teachers, please stay online. I would now request Ms. Shilpa Wagh, Assistant Professor, Department of Nutrition and Dietetics from Dr. BMN College of Home Science, to please come and take over and start with the Teachers' Day event. Thank you.
Thank you so much, Roma. Good morning and a warm welcome to all of you. Let me share my screen. Are you able to see the screen, Roma?
Yes, Shilpa, we can see. We can see.
Thank you, ma'am. Good morning and a very warm welcome to all of you. So one of the most awaited days in the year for all of us is finally upon us, 5th September. This date holds a very special significance for each one of us. Yes, Teachers' Day. It is on this day that a great academician and former President of India, Dr. S. Radhakrishnan, was born. Hence, his birthday is celebrated as Teachers' Day. So, to begin with, I request Professor Mala Pandurang, Principal, Dr. BMN College of Home Science, to say a few words on Teachers' Day.
Thank you, Mrs. Shilpa. A very good morning on this special and unique event of Teachers' Day 2020. For the first time in the history of Seva Mandal Education Society, we are conducting the Teachers' Day function online. And I really miss the fun and warmth of being able to meet and greet all of you in person. The lockdown, which was enforced due to the COVID-19 pandemic, brought a number of things in our daily life to a standstill, including physical lectures. But our teachers have all stepped up to the challenge, and all of you have put in your best efforts to remain a constant factor in the lives of your students and to ensure that their learning continues despite social distancing. In many ways, we became students ourselves. I would like to use this opportunity to thank and congratulate every teacher of colleges under Seva Mandal for your dedication, conscientious efforts and determination to ensure that we continue to be there for our students come what may. Remain hopeful and positive that we will soon be in a position to meet each other in person after 6 long months. Happy Teachers' Day once again.
Thank you so much, ma'am, for those kind words. I now request Dr. Dilipbhai Trivedi, who is an eminent doctor and a very experienced teacher and president of Seva Mandal Education Society, to address the audience.
Friends, to start the Teachers' Day program, I would recite Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Param Brahma, Tasmai Shri Gurave Namah. My Vandan to all the teachers of this college, and on behalf of the management, I would like to put on record that the progress made by this college, almost I would say about 50 plus years, the backbone of the whole progress are the teachers. And I will tell you, the students who enter this college, they come from all castes, all creed and economical status. But if you see them when they leave, they are different person. They are polished, and the whole credit goes to the teachers. So I would say that even in the time when we are in a pandemic situation, they have worked so hard. As Dr. Mala Pandurang said, that our teaching progress has continued. And I would say about 80 to 90% of the students are online being taught by our teachers. And I'm sure they have to make the lectures, they have to do the whole thing online, which they are putting their time and energy behind it. So I would like to say Happy Teachers' Day to all teachers. Thank you.
Thank you so much, sir, for those motivating and kind words. I would now request Dr. Leena Raje, Principal, Srimati MMP Shah Women's College of Arts and Commerce, to release the college magazine Vageshwari. I'm just 1 minute.
Just before you just put the screen, I would like to address the teachers on this day.
Yes, ma'am.
It gives me immense pleasure to address this August gathering on Teachers' Day, a very special day for all of us here at SMES. Whether by profession or not, but I believe every one of us is a teacher all throughout our life at our heart. We teach others in our life and we keep on learning from all those around us. This learning and teaching component of us needs to be acknowledged, and therefore I appreciate and I congratulate all of us at SMES today. I also want to congratulate all our teachers for their efforts during last 5 months of pandemic, efforts for keeping our students on track, efforts for boosting their morale during these trying times, assuring them that we are there all the time for you, and building their confidence by online mode of teaching through mentoring. All this has been only possible because of the efforts of all our dear teachers. And I'm very much thankful to all of them for being there with us and bringing our students on track and keeping with them. Dear friends, all your efforts are indeed very much appreciated. Due to paucity of time, today we cannot reward your achievements and hard work. But soon, as Mala ma'am said, we will be able to accomplish that too. I'm extremely happy that during this pandemic also, we will be witnessing a release of Vageshwari, our college magazine for the year 2019-20. Shilpa, now you can open the page.
Yes, ma'am.
Lot of efforts and hard work has gone in this work this year because of lockdown period. The collection of data was being very difficult, but I want to especially appreciate excellent efforts taken by Dr. Gauri Mohan and the entire editors team of Vageshwari for these excellent efforts. Thank you, the entire team. And once again, I wish everyone, you can just go on the next pages, Shilpa. Just let everybody just have a look at 1 or 2 pages.
Yes, ma'am.
These are all our activities throughout the year and activities of different departments that we have compiled together. And this copy is being released today, and it will be available in the hard format as well as soft format next week. Monday onwards, we can distribute the copies. Once again, I wish everyone great times ahead, best of health, best of time, and let us physically meet very soon now. All the best.
Thank you so much, ma'am. 5th September is also most awaited in our institution because it is one of this day every year we felicitate all our teachers who have played long innings in our college. This is the day on which we pay our heartfelt tributes and acknowledge the service of our teachers who have served our college with distinction. So, without taking much of your time, let us start with the Long Service Award ceremony. I feel privileged and delighted to announce the names of our faculty members who are the cynosure of all eyes, the center of attraction today. To begin with, we have 3 teachers who have dedicated 25 years of service to the institution. Mrs. Alka Pant, Associate Professor from Human Development Department, Mrs. Vinaya Vaishampayam, Assistant Professor from Food Science and Nutrition Department of Dr. BMN College of Home Science, and Ms. Paulami Desai from Srimati SCN Institute of Polytechnic. Coming to the 20 years of dedicated service to the institution, we have Mrs. Pallavi Patekar from Srimati SCN Institute of Polytechnic. And finally, we have 5 teachers who have completed 10 years of their dedicated service to the institution. Ms. Shilpa Surulkar, Ms. Sudha Lawrence, and Ms. Rikisha Maniyat from Department of Computer Applications, and Mrs. Ahilya Mali and Mrs. Bharti Dudam from Srimati HMN Junior College of Home Science. Congratulations to all the esteemed Long Service Award winners. They all have been standout teachers who have demonstrated remarkable passion, perseverance, and dedication while being engaged in this noble profession of teaching. These teachers have been playing a key role in shaping the careers of our students. Their wisdom and sagacity have benefited the scores of the students who have gone on to achieve success in life. Once again, congratulations to all our teachers. I now request Hemlata Madam from Srimati MMP Shah Women's College of Arts and Commerce to take over the charge of the session.
Thank you, Shilpa ma'am. A very good afternoon and happy Teachers' Day to one and all. Our institution has always appreciated the services and significant milestone of the faculty. Today, we also take this opportunity to felicitate our staff members who have completed 30, 25, and 10 years of their service. To begin with the felicitations, she's the powerhouse of energy, but always calm and composed, despite shouldering tremendous responsibilities. She's always there to guide others with her systematic and meticulous approach. We congratulate Mrs. Madhvi Sate on completion of 3 decades with the institution. Preeti Shah Madam is very passionate about Gujarati language and is always in the forefront for any literary events. She takes a lot of initiative in mentoring junior college students. Congratulations, Madam, on completion of 30 years of service. Another junior college faculty completing 30 years is Mrs. Alpa Doshi, extremely popular among students and a thorough all-rounder, be it in admission work organizing and anchoring events, or taking initiatives for students' welfare. Congratulations, madam. He adapts innovative teaching methods to create love for the subject among students. He takes pride in organizing Maharashtra Day programs and college annual days as well. Congratulations, Ravindra Sonar sir, for 30 years of dedicated service. An active volcano, bubbly, enthusiastic, and chirpy. She transforms the subject for her students with her passion. Despite being on various committees, her timely sense of humor surfaces every now and then, as her teammates would tell you. Congratulations, Darshana ma'am, for completing Silver Jubilee. A marathon runner of fitness and health enthusiastic who has high energy levels at any time of the day. We congratulate the youngest staff of our college, Dr. Shubhangi Kulkarni, for completing 25 years of service. He is in tune with the psychology of students, and it is these skills which help him to mentor the junior college students. He is also actively involved in co-curricular activities of the college. Congratulations, Sanjay Sonamni sir, for completing 25 years of service. He simplifies the English language for Marathi and Gujarati medium students with his own style. Raju sir is an unassuming personality who executes his duties diligently. We congratulate you, sir, for completing 25 years. Devidas Patil sir handles the sports department and has been instrumental in our students winning countless trophies and shields at district and national level. His planning and guidance come to the fore, especially during tournaments. Congratulations, sir, for 25 years of dedicated service to the institution. A meticulous perfectionist, Bhosle sir demands the same level of punctuality, discipline, and sincerity from his students as is his nature. Congratulations, sir, for completing 10 years in the institution. Next is my name in the list, and I have also completed a decade. I'm grateful to our management members and principal ma'am for their appreciation. An alumna of our college, she has shouldered the responsibility of her department at a very young age. A very helpful and loving person by nature, and my dear friend, Miss Augusta Menon, has also completed 10 years of service. Any college function is incomplete without her, because she is the one who captures these beautiful moments. An ever-smiling, soft-spoken, and energetic person who never says no. The institution is happy to felicitate you, Mrs. Dipali Matkar, for your services. She is the most dialed person on our call list, a technical fire brigade for the entire college. She is always willing to look at new ways of solving problems. Congratulations, Rajni, on completing a decade with the college. We would also like to felicitate the teachers who have completed their PhD in the last academic year or have submitted their thesis. She is extremely passionate and dedicated towards her work. She does an in-depth study and approaches every task with remarkable clarity. Dr. Gauri Mohan has completed her PhD in English from SNDT Women's University, and her thesis is titled Alternate Sexualities at the Politics of Choice, a pure reading of select contemporary Indian narratives. Congratulations, madam. Dr. Hiralal Bhosle has completed his PhD in Marathi from Amravati University. The topic of his thesis being Mumbai Vibhagatil Daridrya Reshi Khalil Kutumbyanche Samatshastriya Adhyan. Congratulations, sir. Her work speaks volume about her dedication and sincerity. Mrs. Rashmi Tupe has submitted her PhD thesis in Marathi titled Priya Tendulkar Yancha Sahityacha Chikitsak Abhyas. We look forward to your formal felicitation next year, ma'am. Congratulations to Dr. Gauri Mohan and Dr. Hiralal Bhosle for their hard-earned doctoral degrees. Thank you, everyone. I now request our MA Psychology student, Ms. Fakera Mamawala, to take over.
Thank you, ma'am. Good morning, respected principal, ma'am, teachers, assistant teachers, and everyone present here. On this Teachers' Day, I would like to thank all of you for helping us and guiding us day in, day out. Even during this pandemic, you all haven't stopped supporting us and have a lot of concern for all the students. We know how difficult virtual teaching is, but you all make sure that our studies aren't affected no matter what challenges come through. On behalf of all the students, I would like to say that we are proud to have such amazing teachers who are always so approachable. I also want to thank the non-teaching staff who keep the admin work up to date and manage other tasks so well. We feel very grateful to have such great mentors in our lives. Thank you for helping us be what we are today and guiding us to become what we want to become in the future. We all must have come across this quote that a good teacher explains, but a great teacher inspires. Your teachings inspire us and do not let us waver from our paths. Wish you all a very happy Teachers' Day. Have a wonderful day ahead. Thank you. Now my friend Sakshi Zarapkar will speak next. Thank you once again.
यहाँ उपस्थित मेरे गुरुजन को मेरा नमस्कार। प्राचीन काल से आज तक सभी लोग कहते आ रहे हैं कि गुरु की तुलना किसी से भी नहीं की जा सकती। इस दौर में यह सिद्ध हुआ है क्योंकि विश्व के इतिहास में, वर्ल्ड हिस्ट्री में ये पहली बार ऐसा समय आया है कि जब लोग अपने घरों में कैद हो गए हैं और इनमें हमें सबसे ज्यादा मदद की हमारे गुरुओं ने। उन्होंने हमें प्रेरित किया, हमें निराशा से बचाया, हमें निरंतर उत्साह भरने की कोशिश की। उनके प्रति मैं अपना शत शत आभार व्यतीत करती हूँ। इस अवसर पर मुझे एक इंग्लिश की कहावत याद आती है, ग्रेट टीचर्स नेवर ट्राई टू बी द बेस्ट टीचर्स, दे सिंपली ट्राई टू ब्रिंग आउट द बेस्ट इन देयर स्टूडेंट्स। इस अवसर पर मुझे अपने कुछ निजी प्रसंग शेयर करना मैं चाहती हूँ। जब मैं इस महाविद्यालय से जुड़ी, मुझे इस महाविद्यालय से जुड़कर केवल एक ही वर्ष हुआ। मैं एमए फर्स्ट ईयर में मेरी एडमिशन हुई। तब सबसे पहले जब मैं यहाँ कोर्स के बारे में जानकारी प्राप्त करने आई थी, थोड़ी टेंशन थी कि पता नहीं कैसे होगा। 5 साल एक कॉलेज में बिताने के बाद अचानक से नए कॉलेज में एडमिशन लेते समय थोड़ी टेंशन होती है। पर जब मेरी मुलाकात किरण मैम और उषा मैम से हुई हिंदी डिपार्टमेंट के, तब कहता है ना, वेल स्टार्ट वेल बिगन इज हाफ वर्क डन। तो इसी तरह से कुछ हुआ, मेरी काफी टेंशन कम हो गई। और इस महाविद्यालय की मुझे सबसे बड़ी बात यह अच्छी लगती है कि चाहे छोटे से छोटा कोई इवेंट हो या बड़े से बड़ा कोई प्रोग्राम हो, सारे प्रोफेसर्स बिल्कुल उत्साह से उसे आगे बढ़ाने के लिए जुड़ जाते हैं और सारे प्रोफेसर्स हमेशा गाइड करने के लिए तत्पर रहते हैं। सबसे अनमोल बात और सबसे अनोखी बात मुझे यह लगी कि सीडीसी की मेंबर होने के बाद मुझे लगा कि शायद स्टूडेंट होने के नाते इतना अटेंड की कि स्टूडेंट्स के भी मूल्यों का बातों
Shilpa ma'am?
She's back, ma'am. Yes, Sakshi. Okay. Ma'am, I think she has some connectivity issues. Should I proceed?
Yeah, can you proceed?
Yes, ma'am. Before we go on to the students' expressions, there are some students who would like to do a small performance for us as a token of appreciation. I would like to, I'm very happy to announce that one of our teachers who have completed 25 years of her dedicated service has also achieved her master's degree in food science and nutrition, and it is Miss Paulami Desai ma'am, who has just completed her MSc in foods and nutrition last year. So congratulations, ma'am, and sorry for it just skipped out of my mind. Sorry for it. I would now request Sakshi Shetty, who would share her expressions with us on behalf of all the students of Dr. BMN College of Home Science. Sakshi is here.
Yes, ma'am. A very good afternoon to one and all present here. It gives me, Sakshi Shetty, from Dr. BMN College of Home Science, immense pleasure today as I am here to say few words for my teacher on behalf of all students. It is said, without teachers, life would have no class. We all have witnessed how the whole world had stopped during the lockdown period. There are many great professional people who slaved to keep the world alive and safe, and we rightly honored them as frontline warriors. But There were some who hardly got any appreciation, but yet decided to continue. Yes, ma'am? But yet decided to continue working silently, and they were teachers. No doubt, we call it a noble profession. They made sure no student's education is left incomplete, being from finding new technologies to that of bringing easy methods for learning. Teachers have just got better and better, as always, even in this new normal. A big salute to all teachers. And to salute this very spirit, here is a small tribute by the students of BMN College dedicated to our dear teachers. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Param Brahma, Tasmai Shri Guruve Namaha, Guruve Namaha, Guruve Namaha.
Thank you, Sakshi. Is it something else is also there? I suppose.
हम आपने हमें गाढ़ा बना दिया, बंद जैसी कली थे हम, आपने हमें सुंदर फूल बना दिया।
हमें हमारी रूह रूबरू कराया है आपने, माँ ने तो उंगली पकड़कर चलना सिखाया, पर किस रास्ते पर चलना यह रास्ता तो आपने ही दिखाया।
कांटों से भरे इस रास्ते में उम्मीद का हौसला आपने जगाया, शब्द ही कम पड़ जाए ऐसे गुरु को हमने है पाया।
रोए जब हम तब सहारा बने आप, टूटे जब हम तब सितारा बने आप। हंसे जब हम तो हमारी खुशी बने आप, कहना ही क्या आपके बारे में।
इस भटकती हुई दुनिया में सरल आशा बनी आप, सिलसिला इन अल्फाजों कब पढ़ते हैं आपकी प्रशंसा।
आपका और हमारा रिश्ता है एक सुंदर एहसास, आप हमें कभी दूर न करना, बस यही है एक आस।
Thank you, students, for the wonderful poem and amazing video. It really means a lot and we are really touched. I request Mrs. Shilpa Shittigar, Principal, Srimati Sunanda Pravin Gambechan Shah College of Nursing, to give a vote of thanks.
Thank you, madam. Good afternoon to everyone and wish you happy Teachers' Day. I feel privileged to thank everyone on this special day. Teachers play an extraordinary role in our life. They are the people who educate the society and impart their knowledge upon impressionable years. It is the supreme art of a teacher to awaken a joy in a creative expression and knowledge. A good teacher can inspire hope, ignite the imagination, and instill a love of learning. On this auspicious day, let us remember all our teachers in our life who have molded us into the human beings we are today. A sincere thanks to all management members who are a source of inspiration and always guide in keeping the future in mind and prepare us to face all the challenges of life in a positive way. A special thanks to Dr. Dilipbhai Trivedi for delivering welcome speech for today's program. Teachers are the role model to young generation. They affect the heart of every child and they continue to affect the eternity in the days to come. I feel great pride and honor on this day to thank all our alma mater who play a great role in making what we are today. Also, we would like to acknowledge the support of co-curricular committee members for arranging this online program. I would like to extend my sincere thanks to technical team who has supported for this program. Lastly, I would like to end with a quote: great teachers emanate out of knowledge, passion, and compassion, quoted by APJ Abdul Kalam. Once again, thank you everyone. Stay safe, stay home and stay safe.
Thank you, Mrs. Shilpa. I think
Shilpa ma'am, also,
thank you, Mrs. Shilpa. But I think that we should also thank Dr. Virendra. Thank you, Doctor, for staying with us till the end of the program. And we really look forward to welcoming you to college once the lockdown is over. Thank you, sir.
Thank you, sir.
Thank you. Shilpa Bagh, ma'am, you may conclude the program. Yeah, I think that we have lost connectivity with Mrs. Shilpa Wagh. So once again, on behalf of everybody, thank you so much for being with us here today. Thank you.
It was a pleasure delivering the talk and witness this Teachers' Day felicitation program. I guess we can conclude now. Thank you
Doctor,
so much.
is Meghna online?
I'm at my clinic, so I think.
Okay.
He was there initially. He might have.
Yeah. Okay.
I'll convey your blessings to her.
Yeah. Thank you. Thank you so much.
Thank you so much.
Thank you.